What is a deviated septum, and why is my nose so congested, especially when I lay down? Nasal congestion can come from a variety of different causes. Generally, obstruction, nasal congestion happens because of anatomic narrowing inside the nasal cavity, typically involving either the septum and or the turbinates inside the nasal cavity. The septum is basically the middle wall of the nasal cavity, and when it deviates, most commonly it's basically because it just outgrows the rest of your face. Frequently your nasal cavity and face finish growing at some point in life, but then the septum keeps trying to grow and it keeps trying to grow, so it buckles. And as it buckles, it causes narrowing in certain areas of the nose. And because it's narrowing, there's not much space to begin with, so it takes very little additional swelling for the nose to close off completely when some of the other soft tissues in the nose become more swollen. The turbinates are shelves of bone that come off the sidewall, and these are covered by soft tissue. This soft tissue has a lot of blood vessels in it, and so anything that causes more blood to flow to the head will make them swell, such as having a cold, allergy flare-ups, sinus infections, but especially gravity is a big culprit. So when you lay down, gravity causes more blood to flow to the head, and as a result, those turbinates swell, and so it takes up more space. And so that's why when you lay down, those turbinates swell and there's narrowing that happens, and so you get congestion in the nose when you lay down. Whereas when you get up, gravity pulls blood away, and so they open up so you can breathe a little bit better when you get up. The two sides of the turbinates also take turns sharing their blood supply. So whenever one gets more blood, this one may have less. And so this side might breathe a little bit better for a while. 6 to 8 hours later, this one starts getting more blood. Now this one shrinks down. So now this side can breathe a little bit better. There's more space there. If you lay on one side, this side tends to fill with more blood, so this one will get more congested and obstructed, whereas this one shrinks down. So when you lay on this side, the top nasal cavity can breathe a little bit better. Whereas if you switch sides like this, now this side swells and this one shrinks down, so now this side can breathe better. Now this alternation is actually normal physiology, so there's nothing wrong happening there. Now having a deviated septum to some degree is actually very common. Most patients have a septal deviation to some degree. Not everybody's bothered by it, and so just because you have a deviated septum doesn't necessarily mean you have to have surgery. I tell my patients all the time that I have a horrible deviated septum, but it doesn't bother me, so I leave it alone, and there's no problems there. However, if nasal obstruction is a problem for you, in my next video, I'll share some of the evaluations that we do as ENTs to get to the root of the problem, along with some other management options that are available.